Exchange Challenge, and it's my first time back in the Big Apple since we won. It's really great to be here and to just have to build the network and the connections that we need to build our expansion into New York. We've come a long way in a few months. Back in the collaborative space with other founders and with the entire Cure team. And it's exciting to see the energy that's here. You know, I have some meetings set up already. This is exactly why I applied to be a part of this program. It's also one of the reasons I was super excited and grateful to have won, because this is going to provide us with a blueprint and exactly the steps we need to grow and scale. We're just at the start of the journey, and I think being a part of Cure is really going to open up a lot of doors for us as we start to build out Oban from the Bay Area to from California down here, and also looking at next year when we're looking at doing a seed round. The round of funding is going to be used to primarily build up our AI technology. If you think about the workflows for barbers, like how do they enroll patients, generating the reports that they need. We don't want them spending 20, 25 minutes doing these reports. That's where we use AI. So there's a lot of workflow automations that we're doing. Two is hiring the talent we need. So right now we're hiring for engineering roles, but we're also looking at hiring additional clinicians in the next year or so. And then the last bit is executing these paid pilots, which is going to be a great leverage for us getting more customers and health plans. So we want to be able to use this as case studies, as saying, yes, what we've accomplished over the last year or so. And in our conversations, we started with health plans. That's really important for them because they want to see the outcomes we've generated. And a huge part of this fund is going to be used to do that. It's been a few months since I won the Cure Exchange Challenge, and it's my first time back in the Big Apple since we won. It's really great to be here and to just have to build the network and the connections that we need to build our expansion into New York. We've come a long way in a few months. Back in the collaborative space with other founders and with the entire Cure team. And it's exciting to see the energy that's here. I have some meetings set up already. This is exactly why I applied to be a part of this program. It's also one of the reasons I was super excited and grateful to have won, because this is going to provide us with a blueprint and exactly the steps we need to grow and scale. We're just at the start of the journey, and I think being a part of Cure is really going to open up a lot of doors for us as we start to build out Oban from the Bay Area from California down here, and also looking at next year when we're looking at doing a seed round. The round of funding is going to be used to primarily build up our AI technology. If you think about the workflows for barbers, like how do they enroll patients, generating the reports that they need. We don't want them spending 20, 25 minutes doing these reports. That's where we use AI. So there's a lot of workflow automations that we're doing. Two is hiring the talent we need. So right now we're hiring for engineering roles, but we're also looking at hiring additional clinicians in the next year or so. And then the last bit is executing these paid pilots, which is going to be a great leverage for us getting more customers and health plans. So we want to be able to use this as case studies, as saying, yes, what we've accomplished over the last year or so. And in our conversations, we started with health plans. That's really important for them because they want to see the outcomes we generated. And a huge part of this funding is going to be used to do that.
Welcome to Tuesday Talks. I'm Seema Kumar. I'm the CEO of Cure, and I'm coming to you here from Cure Studios. And today we're joined by Cure Exchange Challenge winner. His name is Peter Njonwe, who's a founder and CEO of Urban Health. And Peter started his company based on a personal story that inspired him to actually start this company. And the company's mission is to improve access to care by building an AI based operating system that delivers healthcare actually in non traditional healthcare spaces, such as barbershops and salons to begin with, and maybe more spaces. Oben's vision is to provide preventative healthcare benefits and health equity access to these sort of in places that they call third spaces, and they call this approach micro retail care. So, Peter, welcome. It's so great to see you.
Oh, thanks, Seema. It's a pleasure to be here and excited for the conversation.
Yes, and it's always wonderful to see you, and I'm always really inspired by your story. So, for those who don't know, tell us your personal story and what inspired you to start Oben Healthcare.
Yeah, so Oben's really driven by a tragic story. So a couple of years ago, my brother at the age of 36 passed away from uncontrolled hypertension in his sleep. Um, he went to bed and he didn't wake up. And um, you know,
Sorry to
that
hear that.
sharing that story just brings
Yeah.
uh, a ton of emotions and just thinking back at that moment, like how could that happen to someone so young at 36 years old? And I was confronting my own mortality at that time too, just in the sense of if it could happen to him, it could happen to me. But beyond that, it's the whole idea of I've seen family members go through that, right? Hypertension, seeing how it was normalized in our family, seeing how it was normalized in our community, and that was a wake-up call for all of us. And the thing I just asked myself was, we know how to solve this. We know we have the medication, the technology, and what you may want to call everything that we know how to treat hypertension. And that this still happens to my brother. And yet I still have family members having comorbidities as kidney failure as a result of high blood pressure. And so that to me was that impulse to start something, because if that was happening to Paul, was my brother, that was happening to millions and millions of Americans across the country.
Yeah, so tell us about health equity issues that you were seeing in your own backyard, actually, right?
Mhm.
And you decided to sort of do this and solution through a revolutionary AI-based model, right, to help regain trust in medicine for patients again. And as you said, this is a completely preventable disease, right? And
Mhm.
so education and awareness should actually be the beginning of the way to actually prevent this.
Absolutely. And, when you think about like so hypertension and other chronic diseases, we have the solutions to solve it. And as you talked about, one of the things that is not well spread is awareness. So I use the case of my brother, and specifically on this is I know there were times he had headaches and fatigue, and you're in your 36, 35, where, however old you are, you think that's just normal. And you don't think, well, maybe I should get this checked, because you don't even think that may be a symptom of something bigger than what it is. And that's a big part of health equity, just literacy around what the symptoms are and what to do, and actually the importance of screening. And so that's one piece of it. And then the other piece of it is really access, right? So let's say you even want to get this, you want to, you're like, okay, I have a headache and I want to actually go into primary care and check. The Wall Street Journal recently came with a study that said 83.3 million Americans have insufficient access to primary care. And this is on multiple layers, right? So one is around people have to take time off work and go to primary care. So the hours don't really work with people's working hours. Again, you can see a divide. If you have set hours, you can take time off. That works well. But for people with shift work, which I was seeing in my community, that was a big challenge. A lot of times as well is transportation challenges. Like these are not close to where people live and work. So they, again, have to take the time. And it's oftentimes they have to decide between, do I care for myself, or do I make money to put food on the table? And too often we only went in when things were worse. So we'd use the emergency department as primary care because that's when we couldn't do more, right? So it became this thing of okay, the emergency care was my doctor, was my primary care, as opposed to using what preventative service that exists, that are currently there, that exists that can help us with the issues we're facing. So there's a lot of these issues around, and I think a big one too is trust. And trust is a huge issue, and I think we can all see post 2020 how trust in healthcare, and specifically in this community, my community, and I see it too, speaking to family members, how the trust divide has only grown and grown because people, again, not spending enough time with your doctors, they're feeling like they're not being understood, and maybe not being understood what's happening with them socially in your homes, like other challenges they're facing. And that makes it really difficult for people to get the type of preventative care that would help.
Yeah, so first of all, the whether it's childcare, your job, getting time off to go, just go get a checkup, all of that is a big barrier. And then after that,
Hmm.
you end up at the emergency room, and then even then, you walk in and there's all these people who don't look like you who are trying to treat you and asking you all these questions that you don't really understand. So it's really, not well set up. Plus this trust issue, right?
Hmm.
And this is really what I want to get to. It's like, why barbershops, right? Why salons? What is it about trust in medicine? What is it about that environment that makes it, so ideal to be in this one of the other spaces where you deliver healthcare education and literacy?
Yeah, barbershops and salons have been they're one of the cultural hubs of a community, specifically in the Black community. And, and the reason that is, it's where people go and there's a bond, there's trust. Beyond just, and I can talk a little bit about the study and the clinical evidence that's been generated of how barbershops can be effective places of care. But I think the core part of that, just to go back to what you mentioned around trust, breaking up with your barber is one of the hardest things. I think the top three things that most difficult things in the world. It just doesn't happen. I mean, I can speak to myself when I've had to change barbers, I never go down the same street. And so that speaks to exactly that level of trust, that bond, because it's where you have really intimate conversations. It's where you feel you're not judged. It's where you go consistently. I know generations, whether it's in my family or friends or community, that I've been going to the same barbershop or salon for 10, 15 years. And that's huge. That's really important because when you have that sort of relationship where it's not just, hey, I'm going to spend 15 minutes with you, but you get to know me, you get to know my family, you get to know my challenges. I tell things to my barbers I don't even tell my partner. So that kind of trust, it's really hard to replicate. And that's the kind of trust that you need in healthcare because it's such a personal, sometimes can be really personal and social. And that's why we start that way. So
Yeah, and
that's a
studies
big
have,
part of it.
and it's not just an instinct, right? Studies have shown that
Hmm.
actually, this is the case, right? Lots of studies have
Hmm.
shown that these are perfect places to deliver healthcare. So,
Hmm.
how did you, so okay, so you have the idea, and you have this thing that you want to do, start a company, build an AI model. So then, how did you go about raising money, starting the company? And you raised what, about $1 million or so of non-dilutive
Yeah.
funding to get started, right?
Yeah, so we did about 1.2. It was a mix of non-dilutive and dilutive funding.
Mm-hmm.
We got some really good, again, one of the winners of the Cure Exchange, and really grateful to be here.
Yeah.
And also American Heart Association is also one of our investors, which is really value aligned. And we also won some non-dilutive funding from the Health Equity
Innovation.
challenge by
Mm-hmm.
Johnson Johnson. So we have
Yes.
some really value aligned investors as well as non-dilutive partners supporting us through the program or through as we build Oben. And really, as went about building the company, one of the things that I wanted to do was really partner with clinical experience. So really, we worked with a community-based organization to really help build the model, like understand the challenges of what it takes to actually to build the relationships with the barbers, have them on board. So we've really worked really well, and they've helped us sort of build out the platform and build what we are to this point. And community is really at the forefront of everything we do, and that's been a big part of building the company.
And you started on the West Coast, right? And so, how many
Yeah.
barbershops are now using your technology? And then you're here on the East Coast, here at Cure, because you want to implement the same model here on the East Coast in New York City, right? So, how many barbershops totally are using this technology now? And what is the reach in terms of the delivery of education and care?
Yeah, so there's about to a community-based partner. There's what 17 barbershops, about 35 barbers and stylists, and then we're looking to expand again really beyond the Bay Area to Sacramento, and then hopefully by the end of the year next year. And yeah, and as part of these, being a part of the Cure Exchange winner is we are aiming to expand to the East Coast, and New York is definitely one of the places it's key on our list because it has the highest density of barbershops. And also, we know in terms of need that would be really great area for us in terms of the patient population we can serve, the kind of impact we can create. And so that's why this is really important. Again, being a part of this really gives us the partnerships and that reach that we're looking for. But yeah, so far we've been able to build a lot of our contacts and understand exactly what it takes to build this model at scale. And now we're getting ready to start implementing those pieces.
So how do you go about onboarding, barbershops or, barbers? How do you just go approach them and talk to them about this? And then how do you train them? How do you onboard them?
Yeah, and so the first 5 ones, more or less, was, you know, my barber. You have to use your own personal relationships, sort of, to kind of get going. But once you really understood the kinks of what it takes to bring them on, so now we have barbers referring barbers. So there's some barbers that work at multiple barbershops. So there's word of mouth. That's one way. We've also have so once we identify an area code, so this is exactly how we work with health systems or plans, is once we identify where they would want us to be, or maybe where there's high utilization, or where they are not really engaged with this low patient engagement. Again, they have a lot of this data based on claims data, utilization data. So we go in there and we find the right barbershops to partner with based on zip codes. Most of them, again, right now we've been in a lot of urban areas. And once we're there, so once we've identified the core barbershops, and again, these are based on how long they've been there. We have a criteria, patient, like client mix, like what are the ratings, like things like that. So we're really very clear about what kind of barbershops we want to work with, or salons, community partners we want to bring on board. And so once we've identified them, they go through a training, 12-hour training, where they get certified to be community health workers. They're trained again on, right now we're focused on hypertension, so being able to screen for hypertension, as well as being able to talk about it. So being able to provide some health coaching, education, and awareness. So in a scenario, if a patient comes in and your blood pressure readings are a certain number, being able to talk to the patient about actually what that means, right? So if your reading is, say, 180 over 120, you're in a hypertensive crisis. What does that actually mean for the patient? Having a conversation, as well as anything else that they may face socially, any barriers that they may face. And so that's really, so once they've done that training, they get certified. So 12 hours training, and then they're ready to get started. And what we're building on is providing them resources as they go about, so that they can start with hypertension, but being able to expand to other things as well as we grow.
That's great. And now, as part of your challenge winning, things that you received from Cure was mentorship from John Madison. How's that going?
Yeah, so I've been in New York, and I'm gonna set up some time with John to talk a lot about because one of our biggest challenges is how we're going to data interoperability, and how we integrate the data that we capture in the barbershops and this third places back into health systems. So John's going to be really instrumental in helping us, because again, based on the work he's done at CMIO at Kaiser and at different health systems, like really understanding what we need to get the data back, like, and ensuring that we can get health systems that can do things like rapid identification of patients that need help, really understanding what sort of AI agents we can do to help, anything around clinical decision support, where if you identify a patient in a barbershop, how to best reach them, how to ensure that they're getting the care they need right at that time. So I think those are pieces that I'm really excited to talk to John about, and really figuring out how we can, because one of the big challenges implementing this community-based models of care has always been data interoperability, and that's one of our big challenges that we're focused on solving right now.
Yeah, I'm glad that as part of the Cure Exchange, you're receiving the mentorship from John as well. That's critical, as you know. But the other challenge, of course, with community-based care is, payers and, insurance companies, and how do you get insurance coverage? So how are you going about addressing that? You've been having a lot of conversations with insurance companies, right? How is that going, and what's the process there that you are following?
Yeah, so there are sort of three buckets, and the good thing about this is, and I think you mentioned this earlier, was this model of care is already it's evidence-based. It's been shown that it works, and multiple organizations have tried it, whether it's locally and nonprofits have tried to do these models of care. So that already opens the door for conversations because it's not about, oh, dude, does this work? That's the hurdle is already cleared. So the thing about what's great right now is that there's a lot of tailwinds for implementing this type of model. So I'll start with one. So the first piece is around the community health worker reimbursement. Uh, Before, when this model came out, that wasn't really structured as well. But now a lot of states, wanted to expansion of Medicaid, as well as 1115 waivers, which New York has just again expanded. But are starting to reimburse community health workers for the work they're doing. So these are people in the community that live there, that understand it, and barbershops and salons really fit that demographic really well, which is why the training is important, and they get reimbursed for the work they're doing. So that's part one of how we get paid. It's really tapping into that community health worker reimbursement, which is there's a lot of push because a lot of evidence that has shown that that works, and we are right at the tailwind of that. And the second thing, piece of that is a model is really a chronic disease model where we provide the tools for them to launch these community-based programs, this chronic disease-based programs, so they can improve quality metrics, anything around closing gaps in care, ensuring that patients are, everything around implementing value-based value-based models. And so our model really fits within that space. And so a lot of health plans actually want to pay to implement this because this is something they've always struggled to do. And now we're operationalizing an evidence-based model where they can pay for patients per patient per month so that they can get the care they need, and we can demonstrate that there's outcomes to this because we know the barbershop model works. So that's kind of the second piece around value-based, the care we're delivering around that. The last bit of it is really around the software piece, the platform that we're building. So access to the tools they need, the dashboard, the reporting metrics, which is again a key part of value based because you need to be able to report on those things. You need to get the data to get back into your EMR systems. So we charge a SaaS platform fee for access to the platform, and so those are kind of the three tiers of how we work with plans and systems.
That's great. It's such an inspiring story, to really, take something that was a tragedy in your life and then turn it into something that has positive impact on the world. It's just remarkable to hear. And, I wanted to ask you one last question before we go, and that is, what does cure mean to you?
Oh, that's a really good question. Um, cure cure means to me not cure means to me bringing people, not forgetting people. I think, and in the context of healthcare, um, like one of the things I've seen and I've encountered is a lot of times when we think of healthcare and how people get healthcare, we only think we forget a group of people that really have issues accessing it. We don't think about the issues around just getting care. We think about, oh, here's medication, here's how you do this, here's, here's this thing, here's how we've designed the clinic, you show up to the clinic. I'll give you a good example. Right now, if you have uncontrolled hypertension, the gold standard is that you have to show up to a clinic every 30 days so the doctor can kind of manage your care and be able to see you. But no one's going to do, like, people just don't do that. Like, someone who's going to take time off to go and show up at a clinic every 30 days it's really hard for a certain group of people. And if we don't design care to account for that, to account for some of these disparities, to account for, like, not everyone's the same, not everyone has the same socioeconomic status, not everyone lives in the same zip code. Like, cure to me stands for that. It's like, if we're going to make a huge difference and impact in healthcare, we've got to really rethink how can we deliver care in the most effective way where we're meeting people where they are. And that's true cure. We're going to heal our problems and help people live better lives and actually ensure that no family goes through what went through with my brother Paul. That's where it starts. And that's what cure to me, and that's why I'm excited to be a part of this, because it really is a grassroots of making impactful changes right at the root cause of it.
And no one gets left behind, and people have access to care. So thank you so much, Peter. Thank you for joining us. It's been great talking to you, and congratulations again on winning the Cure Exchange Innovation Challenge Prize. It's been great talking to you. And for more information about Peter, his work, about urban health, go to www.wewillcure.com. And we'll see you again next Tuesday. Bye for now.